to computer. Okay, we're on. So good evening again. It's January the 10th. It's the weekly Wednesday night call with Dr. John Gluckman, Dr. Ken Pepperdine, and Dr. Ron Borsimas Sr. And today's special guest is none other than Dr. Joe Ahrens, the creator, the founder, the inventor, the patent holder, the Nobel Prize nominee for our super product in Igalen called Emulin, the newest version being Emulin E. Tonight's call will be primarily questions from the two other doctors who will discuss with Dr. Joe any of the new thoughts, any sharing about future products that he has in the pipeline. So why don't I just hand it off to Ken to start for a minute to just greet Dr. Joe, and we can get started.
Thanks,
Okay?
Dr. John.
All right.
I have to say, first of all, I'm just thrilled with the product personally. I have more energy. I had a knee that was reconstructed after a ski injury in 1984. And I was babying it until Emulin. Now I can cycle, I don't even think about stairs, things like that. So I'm personally grateful. One of the things that I thought, and perhaps you can flesh it out, Dr. Ahrens, is that this time of year people are concerned with weight loss. We know that Emulin is a strong anti-inflammatory, and that's one of the most powerful roles. That's the role that we tend to hit on strongly with patients, at least I do. But I'm looking at liver function, and I'm looking at the role of fatty acids in the liver. When we eat too much carbohydrates, the liver gets blocked up with triglycerides, and the liver has about 500 functions. And the role of that, I think, is underestimated for those people that are listening or watching. Beyond weight loss, I mean, unblocking the liver is just huge. I mean, body function improves throughout. And having triglycerides, your liver packed with triglycerides is a little like putting Jell-O in the filter in your fish tank. I'm wondering if you could touch on that.
Well, I can, and so let me say a few first things. Look, call me Joe, and if you have to call me doctor, call me Dr. Joe, especially other doctors. But, you know, I'm just Joe. I happen to go to school, you know. So it's Joe or Dr. Joe, please. I love to call all of y'all doctor too. I recognize that, but just Joe or whatever. So, and yeah, you know, the liver. The best function of the liver, particularly chicken liver, is to be eaten with green peppers and onions. I just want to point that out to anybody. You know, a lot of people dismiss the liver by saying, oh, it's a blood filter. You know, it's just part of the lymph system. And it's certainly true, but it's the, you know, it's the second heart of the body, so to speak. It regulates everything. Yes, it's a filter, but it's constantly through chemical feedback and chemical intermediaries. It's always adjusting everything in the body. And I can't say that I know every interaction of the flavonoids and Emulin to the liver. I know a few of them. This started out very simply wondering how did somebody eat something like grapefruit and it affected their carbohydrate metabolism, and just measured by glucose and insulin in the bloodstream after someone has been eating grapefruit. Knowing a dramatic difference, then we moved to chasing that down, and that took several years, actually around 7 years. We found out that, yeah, it's these polyflavonoids, a family of them, which you find in Emulin, that is myricetin, chlorogenic acid, and quercetin. Now, there's tens of thousands of polyflavonoids, and they all have a similar effect on the body, but they don't all do the same thing, and are actually our very well, our second study showed that it was not just polyflavonoids. We initially started with rats that were STZ dosed, so they had no functioning pancreas, and we did a 500 milligram dose equivalent of just polyflavonoids. Like, so we gave 500 milligrams of general polyflavonoids, 500 milligrams of myristotin, 500 of quercetin, etc. And then we started doing combinations, 250, 250, 200, 200, 100. And we found out through that we could have an impact on several different phases of carbohydrate metabolism. If you look at a glucose challenge, which the liver is right there in the center of it, we found out that we could impact the peak glucose, which is separate than the 2-hour postprandial, which is the standard measurement. Now that's really interesting if you think about that. I mean, that we could spend a day or two on that, but those are two different things going on there. Also, the area under the curve, and then the next morning coming up with the fasting glucose levels. We could change each one of these by adjusting the different flavonoids themselves. That still remains mostly a mystery to us, what they are exactly doing. And one day we will find out. But the liver tends to adjust the chemistry of the body by apparently measuring free fatty acids. So these are basically fatty acids that are the ones that are just floating around in your body, are not bound to anything, and they've not made any long chains. They have not yet clogged up anything, but the free fatty acid balance causes other fats and glucose to go in and out of fat tissue. It's not just leptin, these hormones that decide to store fat, but it's measuring these free fatty acids and the amount of glucose in your bloodstream, and then through, I'm sure, dozens of steps, causing fatty acids and glucose to be incorporated into fat tissue at the G1 phase, or causing the release of glucose and fatty acids. Now, the fat tissue does store glucose in addition to fats, predominantly fatty acid, but there also is glucose in the fat tissue. And I'm just frank with you that this is is a mystery to us. I want to share something with you that you just said. Well, two things. First of all, for the layperson, it is easy to understand, or they think that, okay, you eat a bunch of fatty acids or just fat, and it's floating around in your blood and it clogs up your artery. I mean, you know, that's just very simplistic, and maybe they can get that, but it's really not the case. Other things are being measured in your blood, and then the liver sends out intermediate metabolites that end up having your arteries clogged with things such as cholesterol. It's not a direct, you know, you got fat in your blood and it finally fills up like a sewer pipe. That's not how that works. But the liver does measure those free fatty acids and then causes thinking this, you know, we're on fire, with us send out the fire department. Then it sends out and manufactures and sends out cholesterol and other chemicals that they end up is what clogs your arteries. Now, how are you going to get that liver to perform in its most possible best function? What you just said right then. You have got to clean out the liver.
Yeah, and one of the other things that occurred to me as a secondary benefit is when you decrease systemic inflammation, you also decrease peroxidation of those lipids, which is a health problem.
Yeah, because we got to go back and look at what is inflammation all about. Hey, it's the first line of defense. We've got to have inflammation. I mean, without it, we'd all be dead in just a couple of weeks. You get any insult to the body through any system, and you are going to you increase blood flow to the area. Well, that's why it's called inflammation, because it looked like it was on fire. Along with the dilate, and we send out signals that dilate the capillaries. And then you end up having increased temperature there. So it looked like it was on fire. But of course, now the step 2, 3, and 4, as we start sending out the different white blood cells, they're looking to eat stuff up. They are an army. This is how I explain it to my subjects, is that they're an army. They're looking for a fight. And if they don't find something to chew up, after a while, they start chewing up your own body because they can't figure out what they're there for. I mean, that's a simplistic term. During the inflammation, we've recently learned that myristotin in this complex, myristotin, which appears to be the big daddy, it appears to block the action of tumor necrosis factor alpha, which is the keystone right there in the process that you're talking about. Tumor necrosis factor alpha is cytoleucine, but it sits at the top. It's the linchpin, and it's sent out there as the general to have all these soldiers tear things up. And it does not look like we're having any effect on the tumor necrosis factor alpha binding sites. There's two major ones, receptor 1 and 2. It looks like the effect is in the calcium flux, which causes tumor necrosis factor alpha to, although it's manufactured, it doesn't go into action. Now, this is good news. You know, this is the problem with talking to a bunch of medical doctors, because we could just go down this line and it's so interesting and maybe leave other people behind. But tumor necrosis factor alpha is will set off a cascade of other inflammatory markers, and it looks like we are not binding or interfering with its receptor sites, receptor 1 and receptor 2. The reason this is important is that if you booger up the receptor 1, you can cause actually muscle damage, because it's responsible for some other metabolic pathways. And I recently looked at this regarding multiple sclerosis. When people interfered with binding on receptor 1, basically their muscles leaked out and degraded. But we're not doing that. We are not interfering with the TNF-alpha binding. We're actually interfering somewhere between the expression and it being activated. You know, every single step in the body, when you say, okay, this is it, just like glucose going across the gut lining, there's 12 steps right there. And you could be interfering in any one of them. Well, so this is going to be a long story that's going to last past any of our lives. But I just want to bring that to everyone's attention here, that people that are suffering from MS, they have no problems on taking any of this Emulin. In fact, it will do them good. So don't worry about any type of muscular tissue degradation, because we're not acting on the binder sites. So getting back to that liver, it is true in one sense that you can actually clog the artery up, and then you can also have, of course, streaking and liver fatty acid disease. And eventually, it's not cancer per se, but it's like cancer in the fact that if you get your liver clogged and streaked with fat tissue, it can no longer function. And the liver function is lost because these fat deposits interfere with the liver cells' detection of chemicals in the bloodstream, as well as they cannot release the intermediates that go on to cause other signals in the body. That's what's really wrong with liver fatty tissue deposition. It's just like cancer. What's wrong with cancer? cancer takes over the normal function of healthy tissue. Even a lot of MDs don't quite understand what is so bad about cancer. So if you have a benign tumor, you are having rapidly growing and increasing cells that basically have no function, but if they're benign because they're growing alongside of tissue. They can grow in your heart alongside of healthy tissue, and you can go in there and excise those with not any issue. But what we call malignant growth is when cancer cells take over the function of normally healthy tissue, like in your lungs. They're doing nothing. They don't exchange gases. They just are in the way, and therefore you have the disease condition. That's what's going on with fatty deposits in the liver. Completely messes up, like putting a lot of logs in a river, and the river can't process the water. So the liver cannot process the chemicals that it wants to detect and the ones it needs to release. So yes.
So that's one of the wonders of Emulin, because you're routing a lot of those sugars away from the liver and not doing that damage. It was just a point that I think is underappreciated, the value of that as far as your whole system.
Yes, it gets it into muscle tissue and brain tissue. Where would it be if it wasn't going there? That's the problem. It goes to the places it shouldn't be. It goes to the liver. It goes into fat tissue. That's, of course, this season of everyone's concerned about weight. But or it hangs around in your bloodstream. What's wrong with that? Well, it raises blood pressure. It also causes inflammation because of oxidation, as you mentioned. And then you end up, then tumor necrosis factor alpha shows up and starts kicking ass. First thing you know, you got a major insult and the body can't keep up with it. It's just like having sandpaper floating around inside your veins and going through your liver.
So if I can just pop in here from a layman's point of view, hey, Ken, that's an amazing question, and we elicited an amazing answer. I'm going to shift to Ron, and Ron, maybe you can ask the good doctor something that the rest of us will understand.
That's good, John. Well, what that did is really triggered a question in my mind about what I've dealt with a lot of people, and that's candidiasis.
Oh.
Because we see a lot of people dealing with fungal infections. They can't lose weight, and we all know, or at least all of us in the health field know, that fungus or candida is fed by sugar. So how does that kind of relate, Joe?
All right, there's two issues going on there. One of them is, yes, they have a readily available food source in every cell throughout the body, from your pinky up to the top of your head, including hair follicles on the top of your head, which I don't have quite very many of them. But they have a regular available source of energy. But the second thing is not only candida, but many even bacteria and other fungi, they readily invade inflamed areas, readily. Why is that? Because you have broken down the epithelial layer of the total interior of the body. So in a layman's term, I know you know this, but some may not know, there is skin on our outside and there's skin on our inside, not particularly dermal material, but that we are covered inside and out. Right here, it goes right around in your mouth, nose, all the way through you. Every vessel you have has an epithelial layer. This is what becomes the most readily inflamed. Now, even the tissues underneath that and behind that become inflamed. Every cell can become inflamed. But that epithelial layer breaks down, and that becomes a readily available area for invasive activity. So those are the two things right there. I also wanted the third one that we always remember. If you can get inflammation under control after it goes past that first stage, which is good, the acute inflammation. If you move into the chronic inflammation, that's bad. If we can get rid of that, your body then indeed can fight those fungal invasions.
Okay. Do you have a follow-up on that, Ron?
Yeah. In the past, you've talked about once we have Emulin in our body, we can, before we had the E, we could take maybe all of them in the morning once you're past the first 2 weeks. With the new Emulin E, we're taking one in the morning, one in the evening. And generally, what I'm telling people is what it says on the label. If you want to maximize your weight loss, 15 minutes prior to a meal, maybe you could explain that and how that works with weight loss. But could we say that if we're on it, like I've been on it for weeks now on the E, could we be taking all of it in the morning, or do we have a greater benefit by doing it twice a day?
Well, that's a good question. And I would say technically, if you want to maximize the effect, you would take it with meal, like, you know, the two big meals, or the breakfast and the dinner, something like that. But we have structured it and found out that the maximum dose at any one time is 750 milligrams, and that is a saturation point of your body for a person that's around 100, 150, 175 pounds. That's a saturation point. That is based on just purely a calculation of looking at the solubility and bioavailability of these bioflavonoids, and they each have a different bioavailability. They are a little different. They have different hydroxyl groups on it, so they're all a little differently soluble. So 750 for most people on average is a saturation point. So you take them 2 in the morning, the half-life is a couple of days. So you can see that then if the half-life is a couple of days, you take them 750 in the morning, you're not going to have much lower in the evening. You're going to be 2 days later, you're going to still have 350 milligrams available to you, or the end result of 350. However, let's step back a little bit. If someone, there's two people here. There's one who's never had Emulin, and there's one that's been taking Emulin. So you take a native person who has not ever been on Emulin. They have none in their bloodstream, and they take it. That Emulin taken with a meal will cut the effective calories about a third, because it blocks some of the alpha amylase activity in the saliva, and it blocks 25% of the glucose going across the gut. Now, we didn't want to make it 100% blocking going across your gut, or you just have flatulence. You know, nobody would be very happy. You'd lose weight, you'd feel good, and you'd fart yourself to the toilet. But so we just inhibited. We didn't block. We just inhibit. We found the right amount that would do that without have anyone have any gastrointestinal issues. So a person who's never had it before, yeah, they should take it with meals. But once it's in your body, there's not much difference biologically. But again, there may be a little bit more difference, 5 or 10% better if you take it with meals, particularly because chlorogenic acid blocks amylase, which converts starches to sugar, and that you'll have a less effective, less available calories for your body to take up. You'll pass out about a third of them. So I hope that answers. If you've never had it, you absolutely should take it with meals. If you are on it and have built up that 750 a day and it has a half-life of 2 days, it's not going to make any difference if you take it in the morning, you take it in the evening. But there is a measurable difference, but it's a clinically measurable difference. It's not a real-life day measurable difference. You know, it's like there was a statistically difference, but not physiologically difference. Now, I also want to have a third point here. There are people who metabolize bioflavonoids differently, one over the other. Just like Everyone is different. You can taste something I can't. You can smell something I can't. Well, these are all biological pathways here, right? You know, they're metabolic pathways. And there are people that digest and absorb bioflavonoids a little differently than others. So we have found that there is a difference when certain people do need to take even 4 capsules a day. But I still say, hey, take 2, you'll be covered. If it doesn't work, certainly go to 4 before you give up on it, and people find, hey, yeah, I'm fine. I also had a lady, a dear friend of mine, who was on Byetta and shooting herself in her gut every day and praying to God for some relief, and she didn't see any effect, and I have no idea why. She did not see any effect until 30 days. She was almost through with the bottle, and she was depressed, and then like on day 30, she said, this is the day. And she quit her Byetta. She's been fine. But most people see changes in just a few days, 4 days for some, and some of them 750 milligrams is just fine. But there absolutely are some people that need double that amount because they are resistant to the absorption of these polyflavonoids.
So one of the things that I wanted to chime in with, I've been reading some of the comments on various Facebook groups in the last couple of months since we've had access to the Emulin E. And there have been a lot of people have been addressing this question to Dr. Rajan and others, saying that I think I'm gaining weight on Emulin E. Is there anything to that in your experience with the product so far?
It cannot be possible.
Okay.
Emulin E, they could be gaining weight, but it's not because of any Emulin. Emulin E is the same as our original formula. There were no substitutions. We took the original formula, C, and added gallic acid to it. We didn't dilute it. This is important. We didn't dilute the original just by adding extra gallic acid. No, we have the same amount that we had in the original, plus we added gallic acid. There is no way on this earth that gallic acid, which is a bioflavonoid, in combination with these others, could cause any increase in weight. And guys, the placebo effect is amazing. There's a positive placebo effect. There's also a negative placebo effect. This is why you do clinical tests, because people will say, whatever, I have more inflammation or I have less inflammation, and it's the same product. So we do that. We weed out the placebo effect. We go through with the real clinical data.
Okay.
So
can I just ask it? Sorry.
Go ahead, Ken.
If I might interrupt, the Christmas effect added about 4 to 5 pounds to me.
Yeah. Okay.
More for me, and I was taking my Emulin.
Can I just ask a question? This is Adrian Kemmler.
Adrian, we're not ready for questions just yet.
Okay. I just had a statement with regards to the Emulin, because they took it from the C. If people were taking the M, which was supposed to burn fat a little better than the C, if they went to taking the C or the E now, would that make any difference?
Okay, thank you.
I'll mute myself again.
Thank you. Mm-hmm. Go ahead, doctor.
Quercetin does cause additional weight loss. It does that because it causes glucose to be liberated from fat tissue. Athletes use a lot of quercetin. They take it because it releases a flood of glucose from stored energy, and it causes glycogen also to be metabolized faster. I have to say that that's true. However, it's easy to overcome that. If they complain there's not enough quercetin as there was in M, take another capsule of E, you'll have the same amount of quercetin. And when they say, oh, it didn't have an effect, then you know, okay, it's just a placebo effect, because now you've got just as much quercetin as you had, because you'd be getting 50% more quercetin, which you're back to where the M was. You know, we could have 200 formulas, and it would do nothing but lead to confusion.
Yeah.
And even as we were having C and M, the reason we went to M, and probably, you know, in retrospect, we shouldn't have done that. C is the original formula, the one we did the human clinicals on, the rat studies, and also the second big study in West Virginia. And we added more quercetin to make M for people who were not concerned with high blood sugar, but wanted faster weight loss. There's not any more anti-inflammatory action.
Okay.
But let's give them some more quercetin. But we did not want people that were counting their blood numbers to take more quercetin, because you can take some people that are completely fasted and give them quercetin in the morning, and their blood sugar will go up, because it's releasing glucose out of the blood. And also, by the way, a good sign, doctor, it also will release fat out of the liver. Quercetin can be formulated in a product that could reverse fatty liver disease. But that's a whole nother thing. We don't confuse anyone. So we didn't want those people that were worried about diabetes and monitoring their blood prick every day, and then all of a sudden their blood level sugar goes up. They would be concerned. So we said, okay, look, you take the C, everyone else take the M for maintenance. See, that's why the C and the M. And then it just confused. Well, should I take one M and one C? And well, oh, good night, was a nightmare. So then we backed out of that, and we stuck with the original formula. And then with some recent research, we put gallic acid in there, which is phenomenal, also anti-inflammatory, but it also helps with neurotransmission. And it's really going to be part of our new product in our brain formula. It's still Emulin based, but it's going to have gallic acid in it. Gallic acid is, talk about clearing out the liver. Well, gallic acid will clear out the synapses and get rid, you know, I don't know how much we ought to go into that, but you have a signal come across a nerve joint, a synapse. It's actually a chemical signal that goes across the gap. And if you're having some issues because you have a problem with the myelin sheath on the nerve cells, this can actually clean that gap out and cause a better transmission. So we've had really great results with people that have even had Parkinson's disease, where you basically have a short circuit. You have loss of insulation on the wires, on the layman's terms. So this Emulin E is everything the other two were. Doesn't have as much quercetin in it, because we want people that are concerned with diabetes. We're not treating diabetes, but people that are concerned with high blood sugar won't see all of a sudden a flood of glucose in their blood. So we've moderated that. We fit the one right in the middle and add the gallic acid. It's the best product.
Thank you for that. Ken, you want to go on to the next question, and then we'll do one with Ron, and then we'll open it up?
Yeah, I didn't have too much more than that. I'll just have a look at my notes, but that was very interesting. And I've noticed personally a difference in brain clarity with the E. So it is really nice that way.
Okay. So,
you know, just clearing out the liver, getting the gut healthy. The gut secretes a lot of brain hormones, and I guess what I'm trying to underline is the benefit of Emulin, as far well beyond simply lowering inflammation. There's added benefits that come with it. So that's really one of the only things. One of the things that I wrote down is of course stress and anxiety changes gut function, changes liver function. So for people who are stressed and it raises inflammation, there's an added benefit to this, as well as the effect on neurotransmitters. So for anybody who's under stress, they're going to get an added benefit as well.
Well, definitely myristotin and chlorogenic acid promote the right environment for good gut health. That has been proven. That had nothing to do with that stuff, that research, but it promotes a very good gut environment, which is conducive for the right amount of those little buggies to float around in our gut. And, you know, I've always loved to tell patients that there's more bacteria, et cetera, in your gut than there are population of humans on the earth. And the gut is not just a cesspool, you know. It's actually, like you just mentioned, extremely important for our general health. Get your gut healthy, reduce inflammation. We don't even have to talk about all the other stuff. That in itself will cause people to heal.
Yeah, and it's a prime part of your immune system. So the benefits are just outstanding.
Right. Ron, do you have a final question or comment that you'd like to make to Joe?
Just a comment. About a month and a half ago, I was out for a walk, and we cruised at about 4 miles an hour, and I was going downhill, stepped on a little nut on my right foot and twisted the ankle and went down like a sack of potatoes on a belly flop, fortunately not on the concrete sidewalk, but into the grass, spread-eagled out, and 2 days later, I was walking 4.5 miles. In fact, I had to walk 1.5 miles back home after the fall. I think with what happened with that, with Emulin, I recovered so much quicker. Now I'm going to be 75 in July. I'm sleeping better. I don't get up at night to use the restroom, which is amazing for my age. And I just had 2 mugs of coffee before this call. I'll have 15 ounces of water before I go to bed and still stay sleeping and waking up refreshed. And I'm noticing better skin tone than I had before. So thank you, Joe.
You're welcome. And a lot of that is due to better increased blood flow in a vascular system. You know, there bioflavonoids, particularly hesperidin, back in the 30s and 40s, it was actually promoted as a vitamin, and it didn't ever, the research didn't push it forward. They called it vitamin P for permeability, and they found out that hesperidin actually caused the vascular network to be more flexible and more permeable, and basically got the blood to where it needed to go, got the bad stuff out and the good stuff in. And that's really probably, besides you not being under a constant inflammatory attack, your body was able to get that, well, you know, I'm sure, the liver, even though you step on a nut, twist your ankle or whatever, that signal eventually is measured in your liver because you release metabolites at this wound site that travel throughout your system back to the liver, looks at the adjustment, then sends out signals to tell what you need down there, although those signals, those intermediates go everywhere, but they end up getting into your foot. And when your body is working, your bloodstream is functioning perfectly, you've got good permeability of your vascular network, good blood flow, no inflammation. It's amazing what our bodies can do. This is not rocket science. So, well, actually, I guess it's more complicated than rocket science. But my partner that some of you met, Dominique Machin, his daughter broke her arm a couple of months ago, and he had her on, you know, on Emulin, of course. Her arm healed in a matter of weeks. She was out of a cast. And, you know, everybody says, wow, oh, this is just amazing. This Emulin did this. No, I said, no, Emulin didn't do any of that. Emulin just reset your body, and your body did that. That's why you hear all of these amazing results. It's not a panacea. It just fixes a couple of really simple things in your body, and your body is what does all the marvelous work.
True.
Sorry.
One of the things that really stands through to me, and we evolved to be with this stuff. And it's in the last few hundred years that we've been messing with our plants and removing it. And so to me, it's a very innate thing to experience. We're going back to a prior stage in life before we were messing with our food as much.
Yeah.
Yes, that's right. It's just like vitamin C and vitamin D don't cure rickets and scurvy.
Yeah.
Their absence of them caused that disease, and it's we by accident have removed these from our diets. It's not like someone set out to do it. I don't want to jump on geneticists to say they were evil, but we've accidentally left these out of our diet. We absolutely were meant to have them. It is part of our regulatory system, just like amino acids are part of our protein system. We're supposed to have them. And there's not any way, and I say never, we're not going to get this recognized because, as you know, in the 90s, early 90s, the Dosage rules stated there would be no longer any vitamins recognized. Any new food stuff that alleviated a disease would be classified as a drug. So this is why, in particular, I keep telling everybody, don't say we cure this, we cure that. We don't do any of that. We're just like a vitamin and mineral. We need it, and then the body heals itself.
And that's also the answer to, should I take it? Should my sister take it? Yes.
Yeah.
Everybody should take it.
Should they take vitamin E? Should they take vitamin? Yes, everybody needs to take it.
Okay, well, the chorus is in. We should all take it. So, guys, we have another 2 or 3 minutes. I wanted to direct the question to you that you and I spoke about on the call a couple of days ago, and that is, we had a teaser about 6 months ago about a brain product that you're intimately involved with. I just wanted to get a quick update as to where that is and where and when we might be able to see that and what that product might be expected to do.
Well, you know, we just made this vitamin E. We made this Emulin E recently, and it didn't get made on time. We couldn't get a lot to Las Vegas, and there was a confusion. Now people were stuck with C and M, and
yeah.
So I believe that Galen is going to make sure there is a structured rollout of that product, but it is absolutely ready. We have the product ready to go. It is similar to Emulin, but it is not Emulin. What I mean by that, it has bioflavonoids that across the blood-brain barrier. So these bioflavonoids, some of them are quite large and will not do that. So there's a lot of your neurological system, of course, that is not in the brain, and those would be helped, but we wanted to also make sure we were tackling things that were associated definitely in the brain.
Okay.
And we chose a couple of bioflavonoids that were very similar to Emulin. In fact, one of them is, we're going to have myristotin in there, hesperidin that I mentioned, and gallic acid, and probably rosmarinic acid. These are all bioflavonoids, but they have been selected to specifically work on the neurological system. Such as I mentioned, they will clean up the synapses, make sure that the signals translocated across that gap. And Alzheimer's itself has been called type 3 diabetes of the brain. Now we got to tread some thin ice here. We are not going to claim that, we have a cure for Alzheimer's. That would kill us all.
Yeah.
But we can see it promotes, neurological health. You give this product to those people you think that are having suffering for 1, 2, and 3 stage Alzheimer's, you'll be remarkable. It'll be remarkable at what's happened. We've had people recognize their spouses again, start talking. We're going to just promote it as a, you have to say that language. It helps in your neurological fight as you get older, whatever the words are going to be. But talk about being bright now. And you say, I recognize a clarity of thought from taking Emulin. If you are in good condition, of course, you're not going to be that much better. But even then, you'll say, wow, I'm even better. I need to. go love my neighbor more or something. You'll get more clarity of thought, and I'm going to go solve the Israeli-Palestinian conflict or whatever. But you give that to your loved ones, and you will see an improvement.
I got a question on that, if I might.
Sounds great. Listen, we're at 45 minutes. I hate to hurry people, but I do have a commitment to be on another call with this particular platform at 6 o'clock. So we're going to just go another 5 minutes, and I'll open it up for one or two questions, and then we're going to have to shut her down. Any last comments from either Ken or Ron or Dr. Joe? Before we
I got a follow-up question really on what you're talking about with the brain health.
Yeah.
Now that we're using Emulin E, would you say that would be a very good precursor to using the brain health and preparing our body for even better results with the bee?
Oh yeah, I would say that you'll probably get 60 or 70% of the effects by using the Emulin E. There's no doubt, because look, back when we were cranking this stuff out in the laboratory before we were commercially manufacturing it, we were giving out some preclinical trials some of this brain formula, and we ran out, and instead we shipped to this particular individual what was effectively Emulin E, and just didn't tell them, and they thought it was a wonderful product. I don't know, you can whip me later about doing that, but I didn't have anything else to offer. We had no manufacturing facilities, and so I gave them that Emulin E a couple of years ago, and it had remarkable results. So yes, absolutely. Okay, first of all, though, everybody should be on Emulin E. Remember that. So it's not, oh, I got somebody that has Alzheimer's, should I give them Emulin E? No, everybody ought to be on Emulin E. So yes, you'll see. This is a good product. Get them ready for it.
My point, the only point that I was going to bring up is that by using Emulin E, all of us, we're acting to prevent Alzheimer's.
Yes, yes. The beta, the tangles, the tall proteins, and the tangles are actually just symptoms of very similar to construction workers that are in a room doing work, and they leave a lot of lumber, and then the next group comes in and does something. And if you get these things out of sequence and one metabolic system running ahead of the other, you end up with lumber just piling up in the room and nobody can do their work. This is what's going on with this. Helps the process of getting those tau proteins out of the way. They don't build up, and then you have good neurological function.
Well, thank you, Ken. Thank you, Ron. Thanks, Dr. Joe. And thank you all for participating in this call. We're down to the last minute or so. So the recording is still going on. If there's somebody that's brave enough to ask a last question, and we'll try and keep it down to a minute for the answer. Anybody want to do that?
I have one, Adrian.
Oh,
I'm actually gonna read Jennifer Kelly's comment. Said,
please don't. I've already responded to her. So leave that out,
okay.
please.
Okay, perfect. Thank you.
All right, thanks, Adrian. Anybody else? All right, guys.
John.
Dr. Dave?
Yeah, I have a question that came in regarding the E versus the M for hot flashes. Dr. Ahrens, could you speak on that? If you have any comments on that?
I don't know why the E would be any worse than the M. People,
okay.
They did better with M than they did with E. I go back to, it's got to be a placebo. There's a lot of reasons to have hot flashes, and the number one is a hormonal imbalance.
Right.
And my answer is, look, if we can get your body back in balance, I can't count down the number of thousands of hormones that we have an effect on.
Enough.
Get the body back in balance, and let it balance its own hormones, and the flashes are reduced. And there's no reason that E should be any different than M. The quercetin, the gallic acid would not have any effect on
right.
that.
Okay.
Okay, guys, thank you so much again for my co-host and for Dr. Joe. This will be recorded, of course. It has been recorded. It'll be posted on the Facebook groups and also on Debbie Ward's YouTube channel, Everything Stem Cell, etc. So if you need that, go there and get it. Dr. Joe, thanks very much. Good luck with your work on the island. And we will see you all very, very soon, next Wednesday, same time, same station. And remember, we have the event coming up in February in Vancouver with Dr. Scolio, and Dr. Ahrens is going to, Dr. Joe is going to be streaming in the Calgary event 2 days later on the 17th of February with Dr. Scolio as well. So those things are coming up. We also have February the 3rd, the grand opening of the Philippines. If you have any folks there, just let's support them as well because they're doing a great job. That's it for now. Signing off. Good night, all.
Adios, amigo.